Cindy? I should ask you. You're the one really
I'm the
that's
one with
going to be
papers flying
talking,
everywhere.
so I apologize. Not me.
All right, we're good.
All right. Good morning. At this time, I'll call this meeting to order at 8:31. Roll call. Everyone but Kathy is not here. Next is the approval of the agenda. Do I have a motion for the approval of the agenda?
I so approve the agenda.
Thank you. A second.
I'll second that.
All in favor?
Aye.
Say aye. Oppose? No? Yes?
Well, I just feel that, because we should have on here the 2021 budget review.
I understand. I don't know what, if it's on there, do you even have it, Cindy?
I mean, I submitted a preliminary to
Right.
finance, but I haven't gotten any approval back on that yet. Sorry. The budget was sent to finance at the end of August, but we haven't gotten anything back yet from them that would be accepted. And they usually go through by department and let you know if there's going to be changes or different things to what you put out there.
Go through it before it gets to finance.
But we didn't meet in that time frame.
So that's why I figured it would be on the agenda today to go through it.
Because I think you had to have it submitted by a certain time, right?
Right. And we got it, we had about 3 weeks to go over that budget, and that was it. It was a very short time frame to put that together. We can put it on obviously for next month. We'll have it on there and we can go
And
through
I guess I'm
everything.
lost because I know at one point they were talking about it. I know it had to get submitted, and then I didn't get anything sent to me that anything was coming back. So,
We can talk to Paul and then I can put it on for next month if that's okay with everyone. And we'll go line by line then, if you want to.
because at that point, we still can make changes and we have time yet because it's not going to be till November.
Correct.
So would that be okay if we have it on for October? And that way, if there is any changes and we would have to have another meeting, would you be okay to do another meeting with those changes if we have to vote something through?
And I can do in my agency update today, I can do some brief explanations of how it's going to look different in 2021 versus what we've seen in the past due to a lot of the funding from COVID.
Would that work with everybody to let finance bring it back to us? Then we talk about it in October. If we want to make changes in October, we'll just schedule another meeting after our meeting in October with those changes before we have our November.
That'll work.
Because otherwise, we could schedule another meeting before the October meeting to look at it. So then in October, we could vote it through also. It's.
I mean, if we could possibly get it done at the scheduled meeting in October.
Yes,
we'll
right.
keep it at that. If
Yes.
we need to go to a second meeting, we can go to a
Yes.
second meeting.
And we have time. We have time before November. But I did not get anything sent to me on anything. So I don't know what, yes, go ahead.
Yes, finance actually scheduled a second meeting to deal with it because we had a regular monthly meeting. We have a meeting tomorrow at 5 o'clock so we can get this stuff done.
Okay,
So we are working on it tomorrow.
okay.
Because by October, we're going to get that budget binder ready and everything is going to be put together.
If you want to have another meeting before October to look at it, I guess if you're looking at it tomorrow, you said?
Yep.
If we want to schedule another meeting before that?
I don't care. Whatever works.
Would you like me to give you an update now as to where it's at for next year and then maybe you can decide? Would you like that at this point?
What has the protocol been? It goes from this meeting, this committee, it's recommended to finance, and finance then makes a recommendation to the full county board for approval? Or are we actually a part of that process at this committee?
Yes. Usually the department heads come to their committee meetings first with their budgets, and then it used to go to, then it goes to finance for approval.
So I guess I don't understand why this year that didn't happen.
I think it's been different. So in the years past, prior to us having a finance department, it went to this board and we went line by line through it. Once we got the finance department, it was put together and then it's reviewed in depthly by finance more so. And that's what it was the last year or two. And with the short turnaround that we had, we didn't have a board meeting in between for the ability to have it go to you before it went to
So I
finance.
guess
Does that make
comes back
sense?
to why did we have a short turnaround? And I mean, that's not on you, so did that come from the administrator that it, for whatever reason?
Well, and that's what I'm wondering because Virginia, you're telling me you're trying to jam it in. So
So finance is.
No,
already
finance does-
setting
We're
this
not trying to
course.
jam it.
No.
We're just having extra meetings to try to
right,
speed
they
it
haven't
up.
had any meetings to
Yeah.
set it, so they're behind too, is what I'm hearing.
Right.
Okay, what happens is that Paul and Scott take what happened in the past and go through and say, where did it go on budget-wise? They come up with the preliminary, and then they ask each department what they'd like to see in their budget, and then they compare, well, how does it go? And they do ask, go back and ask questions to say, hey, why did you ask this or this? And they put together the budget. Now, when we go at the county level, we can still make changes. We've done that every year that I've been on here so far. When we go to the budget, somebody comes up and says, we need this extra money. And it's been passed.
So we could make these changes, Virginia, in October.
Right,
With you looking at
right,
this
Right.
in October meeting, we could sit down, go through the budget. If we want to make changes at that time, we make changes because we still
Yeah.
have time.
Right.
Because from my understanding from Scott, it's not put together to us till that November meeting, correct?
We're gonna get that budget binder in October to look through it and then vote on it in November.
But they could still make changes to that binder.
Right.
Yeah.
Can't we?
Correct.
Usually by that time, there's no changes made anymore, usually.
Well, then so
No.
that's what I'm going to do. I'm going to reach out to.
I mean, we legitimately got our information to put together a budget on a Friday and all of us met on Monday. So there was no way to put together that full budget before August, our August meeting. And then it was due the third week of August.
'Cause,
So,
yeah, then finance, we're wrestling with the timeline on finance, and if our recommendation then is going to be to the county board to approve, we're already past this
Yeah.
committee
right.
Yeah.
at that point, which doesn't mean at the county board level, like you said, anything can be
Right.
changed at that meeting.
Right.
It's just, this
Right.
committee did
Right.
not get their stamp on it.
Mm-hmm. I'm going to check with Paul and Scott. One of them. And
Have
find
you
out.
guys reviewed budgets on any of the other committees that you've been on?
No,
Not this year.
no, we haven't done anything.
Right. So like,
That's
for
why
instance,
I'm questioning.
Timeline, like you said, I don't think
it
allowed.
it didn't allow for it for us.
No. I know we have, we haven't, no. So,
I can
I'll-
certainly bring a copy of that to the October meeting, and like I said today, I can give you some of the updates on the changes. Our office is receiving changes in budget kind of weekly right now, so I can certainly update you on all of that as well.
okay, and I'll reach out to them, one of them, to find out if this is possible that we can. Otherwise, then at that point, I'll contact you, between you and me. We'll put an email out if we need to sneak in
Sure.
a meeting.
Okay. One other
Yes,
comment.
Virginia.
We're meeting 1 hour before the full county board meeting, so there's nothing preventing anybody from showing up at finance the hour before and listening to what we're having to say in that meeting.
All right, thank you. All right, with that being said, I had the yes and I had the no, and we discussed it. So I'm going to move to the approval of the August minutes then. And do I have a motion to approve the August minutes?
I
Yes?
so move.
A first, a second. All in favor, say aye.
Aye.
Oppose? Is there any discussion on the August minutes? Then we'll move to the citizen input. Cindy, is there anything? I see Tim out there, but,
He declined.
Okay, so then we'll move on to COVID. Update on COVID, Cindy.
Sure. Okay. So I just wanted to give you some of our current numbers on COVID and where we're at today. So as of last Friday, our case count was 242. And what I can share with you is that on Saturday we got 7 additional cases, and on Sunday 14 additional cases. So in the past several months, we've been averaging maybe 1 or 2 positives a day, and in this last few weeks, we've been closer to 4 to 10 a day. So we're definitely seeing an uptick in the community as far as COVID cases. It is not in one area, so I can't tell you that Luxembourg got hit or Algoma got hit. It's been equally spread throughout the entire county. We have had additional cases due to weddings where people have been in attendance, camping trips where people have been in attendance, and the school has led to some of those cases. And in those kind of instances, we've just had a larger population that has been affected. Okay. So we're really trying to get that message out there for people to continue to social distance, continue to mask, continue to wash hands frequently, do those measures that will help see a decline, hopefully, in those cases. I wanted to mention that as of Friday, we had 0 hospitalizations, and we had 1 over the weekend, which we're told will be released today. So, and then we have 1 other one that is hospitalized. So we have 1 hospitalization currently right now, and it is someone in the age group greater than 65. Okay. As far as our positivity rates, I added that to my report a few weeks ago, and I do it in 2 different ways. So the Department of Health Services puts out a positivity rate daily, and that's based on total cases. So that's going all the way back to March, which is somewhat deceiving into the community as far as, what's going on. And I prefer looking at the positivity rate with active cases. So I have both of those listed there because we have different businesses and different schools that are using both of those measures to look at where we're at within the community. But certainly our positivity rate has gone up recently with that influx in cases that we're seeing. Other things that I wanted to let you know about with COVID. So we currently have our staff working on it. So there are 4 of us that work as contact tracers, and then we have hired 1 full-time contact tracer. And we did that back at the end of July, so that's working out well for us. However, with the uptick in cases that we're seeing, I am going to reach out to a list of contact tracers that the state provided us that are in our area to see if we can get 1 or 2 more on. And that will allow for my staff to do their normal caseload as well as the contact tracing and keep us going with all of our grant work. So we're going to do that in the next week or 2 and see what we can find for people to help out. But right now, we've been managing the contact tracing very well. I can tell you that at the end of the day, each day, everyone has been contacted. We don't have an ongoing list of people that carry into the next day where some of our neighboring counties have had that.
Can I ask you a question? So, Cindy, if someone comes positive, so let's say for whatever reason they're ill or they go to a medical appointment and they get the test and they're positive, when you contact trace, let's say that person may or may not have been either in a work environment or a gathering. What determines what people will need a quarantine? How much contact is necessary? Because I get people asking me all the time. It's like, I wasn't next to somebody and I was told to quarantine.
It is within 6 feet for greater than 15 minutes, but that can be a cumulative 15 minutes. So for like work environments, and I'll use like bank tellers. So when they're at their spot in the bank, they might not be having direct contact with their coworkers, but then when they walk behind and are doing the work when active clients aren't there, they may be standing next to a coworker, and that cumulative 15 minutes is sufficient for being considered a close contact.
In a 24-hour period?
Correct. Yes.
And so if someone tests positive, obviously that's very disruptive to that workplace.
Correct.
In many ways. Or a school, because then now all those children have to quarantine, and that means the parents may not be able to go to work, and the
Correct.
daycares are affected and everything. So is it a good thing to have that one person that affected 40 to get retested to possibly get over a false negative?
If they truly believe that their symptoms, for some
Asymptomatic, 'cause
reason,
there's often a lot of asymptomatic people.
correct. We do tell people that are asymptomatic they can get retested. However, if that individual that tests positive has 2 or more of those symptoms, it's really believed that that's a positive case.
Even though we know we've still got many other things such as influenza out there, we're just going on that presumption instead of,
The case sensitivity or the test sensitivity indicates that it's positive.
Okay.
They always have the right to go get retested if they so choose. Yeah.
because if they knew that, I don't know that a lot of people understand that, hey, if, there's reality is there are false negative tests coming back. And I don't know that anybody has the data on how many there are and what
Well,
types of
some of
tests.
them are coming back, they're saying abnormal. Because my husband knows of somebody who had it tested. They said she was positive. They made her go in and get tested, and it came back abnormal. I have it on my phone. That was one
What
thing.
does that mean?
Well, so my husband called a friend who works as a nurse, and she said, yep, those are tests that are coming out because they have patients that are having surgery, and they're having these tests come back, and it says in green, abnormal, and then they cannot have surgery, and they're put as a positive.
And the tests that I've seen, I haven't seen that wording. I've seen
Yeah.
presumptive. And what presumptive means is that they have, and there's a count when they do the testing. And so the count is just below the positivity of that test. So they are like right on the line. And so they are presumed positive, even though they might have, based on the count, a few virus less than what would be considered positive.
So is
And
that
I've
in our
had-
presumptive case count? Is that what those numbers are in our presumptive case count by the county?
No, we have pending. Pending are people who are being tested and are waiting to receive their results.
I think it was on the DHS that I saw presumptive cases. It
Yeah.
was only like 2, 3, 4, or
It-
it
it's
was
a-
a small number.
It's a low number because like in all the testing that we've done, I've had 2 cases in 7 months that have come back as presumptive. So we don't see it very often. We also have had 2 people that have had false positive results. And to prove that it's a false positive result, we send them back for testing, they test negative, and then we send them back a second time and they test negative.
And does that have to be like 2 days later? Or, well, it takes that long to get a test back.
Correct.
typically
So
anyway,
there's not really a date limit in there, but if they can have 2 negative tests, it will negate their positive
Could you take
test.
2 tests in one day?
No. They don't allow that. So they just do your 1 test a day. Yeah.
Okay.
And then you
And
wait
these
for
are
the
coming
results.
back like within 24 hours or?
No, I would say closer to 48 to 72 hours is what we're waiting for
That's-
some of those
That's
results.
what this person, it was 72 hours, and it was 11 o'clock at night, she got a text.
Yeah.
And in the green box, it had abnormal, and then it said, so you need to act upon it as a positive case. And
And in that regard, like if we get a presumptive or if we would get an abnormal, like I said, I haven't seen that one, that would be an indication to send them in for further testing and repeat that so that we can get that
But that
cleared.
would still count as a positive case.
it does.
Until we get the negative back, yeah.
Yep.
Mhm.
And I understand also that all the cases, so if one individual tests 3 times positive, that's 3 positive cases.
That is not correct.
That's what the DHS website says.
Each person goes into the caseload once. So for
They said every
instance,
specimen that's positive, they only look at specimens, not individuals. That's on the DHS
that's
site.
not how counties are asked to count. So if we have a positive, that person is counted once. If that person has been tested 5 times in the last 5 months and 4 out of the 5 were a negative, and then they test positive, they are taken off of our negative count because they have turned into a positive case, but they are not counted in both counts. Does that make sense? Trust me, it's confusing from the health department
Yeah.
standpoint too, but that's what we do. So we keep track. We actually have separate spreadsheets of our positives, our negatives, our pendings, so that we can look at that and keep track of it so that we're not giving you numbers that would not be
So I
accurate.
would not, in that scenario you gave, I would not be able to be counted as 4 negatives and 1 positive.
Correct. You would be one person. And
Which
you're
of
either
my tests then
and
would
you're
count
if
towards
you
the
if you hit the positive, then you're going to stay in the positive.
Okay, but none of my negatives then would be in the negative testing count?
You're taken off of our caseload as a negative number.
Okay.
The
So,
state keeps track of all of your records, but
so that's the full statistic at the state level. All those numbers get added and stay there, is what I'm saying. All my negative case counts, if I was negative in March, April, and May, those 3 negatives are gonna stay in the total tally of
yeah, I would
negative.
have to verify that with the Bureau of Communicable Disease because
Well,
that's not how they tell us to count it.
Okay. So what,
Because we legit, like for instance, I'll use the nuclear plant as an example. Um, the controllers and operators at the nuclear plant are being tested 3 times a day.
wow.
Or not 3 times a day, 3 times a week. So those numbers would just be racking. So, right. So we are not counting it that way in our counts. And we have healthcare workers that are the same way that get tested frequently. Our nursing home staff will be starting to test regularly. Again, they just got an increase in funding to do more frequent testing, so they'll be testing weekly. And those people are still counted as one test.
So in your bank scenario or the workplace environment, if one of those tellers out of 10 was positive and the other 9 employees were considered probable, do they go to a positive test count? Or how are they counted in the numbers?
No. So when we have a close contact that we put into quarantine, they are watched for 14 days. And if after 14 days they do not develop any symptoms at all and remain healthy, they're considered negative.
So they're never presumed.
They're never presumed positive. The only people that we presume anything on would be, let's say, we have a husband who tests positive, and his wife has every single symptom that he has, but maybe was tested 3 days earlier than he was, so hers came back negative, but his came back positive, and they share the exact same symptoms and are living in close contact. That person would be considered probable, and probables are counted as positive cases because they have every symptom possible.
Okay.
And we haven't had many of those either because typically what we do is send everyone in for testing when they have a positive case in their household and they convert over to positive.
Good, thanks.
It's complicated.
It is, but, you're seeing all these numbers nationwide, and, I mean, things are smaller numbers, a little easier to grasp at the local level here, but then you're seeing numbers at the state, 1,200 deaths and 513 are in Milwaukee County. And
Right.
you're trying to understand hospitalizations seem non-existent around here. What is everyone doing with the response?
Right.
At what point does our response mode shift gears?
It's a good
And what's
question.
going to be that benchmark? And I've been asking that since March, what are we facing that's going to change the way we're reacting?
Mm-hmm.
And nobody knows. Just nobody knows.
And I think part of it is that the situation has been so fluid and we see ups and downs on daily basis, and it's just hard because we're not on any level.
Well, just trying
Feel
to
right.
track the curve.
Yeah, it's tough.
And if that was the whole idea in the beginning is to not fill our hospitals and we're not filling our hospitals, well, what's going on?
Correct.
I agree. Blake had to have some more procedures done, so we had to travel. And I was blown away by how different the hospital we went to was compared to Green Bay. We walked right through the front door, no temperature check. And I didn't realize anything till we traveled home. And I was driving home finally from our hospital visit. And I'm like, I never had a temperature check. They allowed me and my husband both to be there. And his COVID test was done within 8 hours. We knew the results. He was taken, and they said, if you don't hear an answer within 8 hours, he knew. And they had their cafe open, and people were sitting in the cafe area eating with no mask and talking. And the doctor spoke to me without his mask on. So it's weird because where we went is a very good hospital, and they looked at things
Very differently.
differently
Mhm.
than how over in this area.
Yeah.
And when I said something to a nurse, she actually couldn't even say anything back to me because you can't even get in the first door where she works without a temperature check. So, and they just viewed it differently, and they said that their biggest concern more is the influenza season, because it affects everybody. And so, and they had, at that hospital, they had no COVID case. Um, so that really was an eye opener. And I guess
That was in the state of Wisconsin though?
in the state of Wisconsin. And we don't do a lot of local with my son. So we have a lot of different hospitals we go to. And it was weird. And I guess I didn't realize it sitting there the whole time. Well, my concern was on Blake. So it was when I was driving home in the car, and I'm like, oh my gosh, this, and then it was like, what's so different? So in the medical field, I'm seeing a lot of different ways of doing things and different opinions on things. So I don't know. I'm hoping for a normal.
Cindy,
Yes.
do the majority of people who are called under contact tracing, do those people end up being tested?
So, they are recommended testing if they are in the same household and showing symptoms, or if they're a close contact and showing symptoms. But for close contacts that are outside of the household and asymptomatic, they're asked to self-monitor. And so for that 14-day period, they're asked to watch their temperature and their symptoms. And if they would notice any kind of difference from their baseline or their normal, we encourage them to get testing.
Because it seems like each day there are quite a high number of pending
Yes.
tests.
Yes. I mean, there are people always getting tested, and a lot of that comes from preoperative procedures. So you can't, in this area, get into a hospital for anything without having a pre-op test, those kind of things. Yeah. If there's no other questions right now, I was going to let you know we're still continuing to work with the schools. So the schools are holding their own right now. We've done okay for the beginning of the school year. So I just wanted to break it down and let you know what we do. So we serve as consultants for them all day long when they have pop-up questions about COVID. We have created what's called a Google Sheets document for each of them so that if they have staff or students that are affected by COVID in any way, whether that be a positive case or that be a close contact, the school knows that person's name and their date that they may return to the building. And we keep that on a daily basis so that the schools are aware who can and who cannot be in the building. For some of our schools, Kewaunee in particular, they've asked for a formal letter as well stating those dates and whether the person is a close contact or a positive. So in addition, for any school, really, we can put those letters out. We have those templates available so that they have a formal letter of return. Algoma has had one staff member that's been listed as a close contact, and they've had a couple students as close contacts. No positives there right now. We have had one positive child in the Kewaunee School District, actually two, but one of them's contagious period fell outside of when they were in the school themselves. So we didn't get affected by doing close contact tracing within the school building. But the other one, last week, Kewaunee got a letter sent home saying that there was a positive student that had been in the building, and the child had attended class with symptoms for more than one day, which is unfortunate. And then what happened was he was placed, we ended up quarantining an entire classroom, which is not our goal in this at all. We want to do just the close contacts if we can figure that out. And so we worked very closely with the district and the administration to do that. We looked at footage of the lunchroom, the library, things like that. but in one particular classroom, all of the chairs were huddled together and social distancing was broke. And therefore, that entire classroom had to be quarantined because the social distancing factor was not followed and the seating chart was not followed. So they couldn't tell who was next to anyone at any one particular time in that room.
Does
So-
the mask, isn't the mask, the idea of a mask to be the safety barrier if you can't social distance?
It is supposed to help with that, but it is not 100% effective. And certain schools have taken that to the next level and have used either the plexiglass or the polycarbonate to make more barriers within the building. But just the masking alone, no, we're told if people are wearing a mask and they are not social distancing, they're still considered a close contact. And then we did have we've had 2 positive teachers at Luxembourg Casco. One was during in-service time, so didn't affect the school with the students in, and contact tracing was actually done by a neighboring county because it was not our resident that was affected. However, the second one was a positive teacher that was in the district and had been attending school and had been symptomatic. So we worked through that whole contact tracing with them and sent back a district-wide letter there. So I just wanted to let you know that that's where we're at with the schools, but overall, we've been fortunate because with the barriers and the recommendations that have been put out there that they've been following, we've been very lucky in that we haven't seen cases spreading in the schools at this point.
I had a question brought to me by quite a few parents. So the schools, you recommend how things are, but each school can do things a little
Correct.
differently. So
Absolutely.
one thing is Kewaunee is pretty much hasn't really done anything with sports. They've practiced and that's it. Where Luxembourg, Denmark, they've been going.
Mhm.
That has none of your control. That's the school itself.
Correct.
That's making the call.
Each district can set in place what they want to, and if they feel that they can do it and do it in a safe manner, they can choose to do that. So that went in front of Luxembourg Casco's school board and was worked through a lot over the summer with their athletic director and things, and they are proceeding with athletics right now. Yeah.
Yeah, and so is Denmark.
Mhm.
Because Kewaunee is kind of on hold and it's starting to, there's parents asking questions. So,
Yep.
and I said I did not believe it was with the health. You just give recommendations and then
Correct.
from there, each school does their own because
Correct.
the health controls all 3 schools. So they would all have to follow the rules if you put a rule out.
Right.
So-
We have no orders out. We have no intention to do orders. We are serving as consultants with them and making recommendations. Yeah.
So I would direct those parents to the school board.
Yeah, it's been hard because the kids are really they're getting affected by it, and it would be different if let's just say there was a rule, but there is none. So it's the school is taking it upon themselves, and so these kids, and just remember, put yourself back as a kid, and they have goals and dreams, and they see these other kids having goals and dreams, and they can't, and they're asking the question, why? Why did you choose to take that away from me? And the other kid next door can go do it. So, and that's been
Yeah,
hitting
that's a
home.
District policy.
And it's been hitting home. And I had some people asking questions, and you know what? My own kids are asking questions.
I've
So,
had the same questions because I believe it's just varsity football is the only sport that's being played. And it's like, well, why can't JV? Why can't
not
grade
even
school?
cross
Why
country,
can't
which is
you run?
outside. Yeah.
Yeah, so they're valid questions.
Hmm.
I mentioned to you that CBRFs or nursing homes, skilled nursing facilities, will be doing that testing regularly. They did receive funding for that. So we're going to see some frequent testing going on in those environments. And we've offered to help with anything that they need as far as assistance with that. As far as local testing, we're happy to hear that Prevea hopefully will be offering local testing within the month. So I've been told that by the 1st of October here in town at the urgent care, they will have a drive-through facility in the back, I believe, where they're going to be doing testing, and it will be done daily. which is nice because right now we have Bellin here in town that does it, but they're only doing it 3 days a week, and it is from 1:30 to 2:30 in the afternoon. So we have limited testing there. Door County Medical Center also offers testing. They have limited testing in their Algoma site. They have greater ability to test at the actual hospital, and that's where a lot of their community testing is done. And finally, with funding, and I've been kind of keeping you alert to some of the funding changes that have come down with COVID. So we've received a lot of money that is available to us for health department use for contact tracing through the end of the year, and for testing. And we've now been told that that there was a pot of money called ECL, I believe. It was an epidemiology-based pot. It was $13,000 that they told us that we were going to receive, and that $13,000 would start now. It started like in summer, but would go till September next year. They've now increased that pot of funding for us, and it looks more like close to $200,000 that we'll receive. However, that will go through the end of 2022. And the purpose of that funding is to help health departments staff for contact tracing over the next year or two, depending on what is needed. And that funding doesn't come in a lump sum here. It comes based on what you bill out. So, and it's similar to what we have right now. That's how our contact tracing is based right now. And that's the funding that we've been fortunate enough to hire our full-time contact tracer with, and bump Jessica Deppes's hours up to full-time as well during this period of time. So just so you know, that funding continually changes depending on what the government happens to see the greatest need is at, and they still are continuing to shift it a little bit. But that's what we've been told now, is that we'll have at least $200,000 as a base rate for every local health department in the state, starting, I believe, January 1st with that one.
That sounds like a lot of money, but it's like 2 years worth of money that we don't know what our expenses could be.
Correct. And we're a small department, so it stretches out a little bit further for us. But, you know, for places like Milwaukee or La Crosse or Brown, 200,000 isn't going to take them far at all. And so they said that that would be the base funding. You may receive additional funding dependent on population status. They haven't released those numbers yet because we're a small county. I'm guessing we'll stick at the base or close to it.
Is that state funding or federal funding?
That would be federal funding, I believe, coming through the CARES Act.
So I'm going to ask one question. I could have did that before, but do you think that the tests are going to speed up more? Because why is some testing getting done real fast and some testing taking 72 hours? Because let's just say somebody was told to go home, they were in contact with somebody, they can't work, they're not going to get paid, and they have to wait 72 hours for that test, and then they find out they're negative. Is there any chance these, you know, because I know it can happen, because like I said, it happened.
There's a few factors that play a part of that. First of all, it's the lab capacity
Okay.
and the number of labs that are certified in that type of testing within the state. So when this all started in March, we had 2 labs in the state that were doing testing, and that's it. And they were going 24/7.
Okay.
We've increased the number of labs, but we've also increased the number of tests. So that's one factor. The other factor is that there's a lot of different types of tests. There are antigen tests and there are rapid tests, and there, you know, so each one of those types of tests that they use take a different amount of time to have them read. So like a rapid test, some of them you can get back in 45 minutes, some of them are 8 hours, some of them, you know, take longer. So it's just different with everything. In each facility right now, because of the limited type of testing available and the limited supplies, they all have different things available to them depending on their suppliers. So it's just, there's a lot of factors that play a part in that.
I know that was a question brought up because a person waited, well, she lost 3 days of work. So she had to take her vacation pay, which she saves pretty much for her kids.
And technically, CARES funding is still available for those kind of situations. So if the employer would look into the Department of Labor, they should be able to get funded for that.
I think it's the size of the business too, probably. How big of a business.
Yeah.
So some of these are small businesses, so.
All right,
Um,
any other questions on COVID?
Okay, we will move then to grant update.
And I kind of just gave you that one. Sorry, I fit it into
Yep,
COVID
is
with
fine.
that money.
Yep. So then we'll go to the reports. So the August monthly report.
All right, so in front of you is the monthly report. You can see that we did maintain our contract caseload pretty close for August. We're at 203, just short of the 218. So that's been going well. WIC's numbers have been staying consistent. We did a little bit more immunization in this month than we have in the past, so that's starting to open up as well. And we have been advertising more with the start of school back up and running. Communicable diseases, 760 for the month. Of that 760, that was 64 confirmed COVID cases, 1 probable, 21 suspect, and 674 that came back negative. And then we did have a couple of other things in there. We had a few chlamydias, we had a few Lyme's disease, we had a hepatitis A. So we have started seeing some of those other diseases coming back into our caseload again. And it's refreshing that they're testing for other things other than just COVID. So other than that, with all of the meetings and different things that were listed, does anyone have any question on the scheduled meetings or conferences, activities? Okay.
All right, then hold on. Let's jump around. Okay, then it's the financial report. Cindy.
I'm going to do the rest of the agency updates actually, because
Oh,
I have
I'm sorry. There's
several
more?
of them for you. Yeah,
Okay.
lots more than just COVID right now.
Okay.
So, just so you know, we are going to start staffing a little bit more on the weekends. We've been pretty light on weekend staffing, and I've been covering the majority of that. But we're going to try to do a rotation now with our staff. So, in that regard, you may see that overtime report with an increase in hours because they'll be covering weekends a little bit more too, with the numbers going up. We have started our flu clinic planning. So we have flu clinics that are now scheduled in each of the school districts. We also have adult clinics that will be scheduled within the community. We have Algoma and Luxembourg sites set up with dates behind them, and then here within our building. And all of those are by appointment only. And then we also have a special day set up for employees here to get their flu shots. So that is underway, and I believe all of our children's vaccine is now in-house that we ordered, and we're just waiting on the adult, and I think our delivery date is listed as tomorrow. The PALS program is going to start up today, which PALS was a physical activity program for seniors that we had received special grant funding for. It feels like forever ago, but it came in February. And we had received all the equipment and things, and we were partnering with the Kewaunee Fitness Center to offer that program. And we were running as a trial within the state on it, and then it got shut down because of COVID. So we are back up. It opens today. They have filled the spots for it, and we're going to run one session this fall. It runs 3 days a week, and I believe it's a 10-week program. And then they receive counseling in there as well from our registered dietitian / fitness director. So we're going to see how that goes, but we're hoping to continue that program and offer more sessions once this trial one is done. And that we're still the pilot program for the state on that one right now. As far as school health, that is also getting going this week. So we will be back out doing hearing and vision and scoliosis screenings in the schools. We have all of our parochial schools that have asked us to come back in and do their services. I believe right now on hearing and vision, the public schools are holding off until the second half of the year. A lot of that has to do with the number of volunteers that they need to run a full vision and hearing screening for that number of students. And at this time, I do believe that visitors are still banned from school unless of special circumstances. So we're hoping to get those done after the first of the year. I wanted to give you guys just an alert that WALDAB, which is the Wisconsin Association of Local Health Departments and Boards, is going to be having a special training. They're offering it virtual. I found out about it on Friday, but I don't think that there's an exact date yet. But they wanted to kind of do a Board of Health orientation as well as an update for you on the state as to where health departments are at with the COVID crisis, what's going on around the state, different things. We have a number of issues with local health departments that have gotten a little scary. We have health officers that need police escorts to their cars. We have boards of health that have picketing outside their meetings. We've had a lot of different things going on in regard to the COVID efforts that health departments are making. And so they would really like to do a statewide orientation for you guys on that and open it up to questions that you might have. So they should be emailing each member of the Board of Health, but if I receive that, I will share it with all of you as soon as they have a definite date out. Next, back to school. I just wanted to let you know that the back to school program was a big success. We were able to serve 142 families, 322 children. While we were there, we handed out 141 hygiene bags that had like toothpaste, shampoo, conditioner, deodorants, those kind of things. 200 toothbrushes were given out. We did have the weather warm-up program there, which is run by a local family that did coats and jackets and sweatshirts and things. We also, in addition, made 16 extra backpacks. That 15 of them were kept here at our office. I think almost all of them are gone. And then we did give some extras to the school districts. So we really had a very good event this year. Everything went well. We did it COVID friendly and it worked very well. We just spread it out throughout the day and it was a very positive event.
Can I ask, since Scott is here, so you talked about overtime, and on the weekends, we know it's not going to be anything like we just talked about, it's with COVID. So there is money that is put in for COVID, and I think you talked about having assistants come over. Can that overtime get used for that?
I have the funding in my budget 100% to cover all overtime that we need.
Okay.
We have testing money, we have tracing money, we have pandemic planning money. All of that right now can be used to staff the health department agencies. So nothing additional will come out of the county levy.
Okay. Any other questions? And Cindy, that was the agency. And then you're good?
Yeah, and then the financial update, I did give you a current budget packet in front of you. And
I did not receive one. It wasn't up here.
Because I passed it out to everyone out there.
Yeah.
Everybody.
I was looking on my phone, I didn't see it, so I'm like.
So basically what I can tell you about our current budget in public health is that we're continuing to spend down our grant funding to the best of our ability. So we continue with all of our grant programs right now, and that funding is continually being spent. All of it will be gone by the end of the year. Some of our grants have ended. Fit Families is just ending at the end of September. Children and youth with special health care needs and the first half of the bioterrorism budget have all been spent down to within probably pennies, knowing Deanne, because she's very good at that. And then as far as the county funding, you're going to notice that it's not getting spent down very quickly. So we will be giving back probably a fair percentage of our county funding this year. And the reason for that is because of the change in job responsibilities. Contact tracing will pay for the majority of the county hours paid to Allie Martin, Rachel Bauer, and Jessica, because anything that they're doing outside of their grant work right now is pretty much 100% contact tracing. And that is also what we'll be paying the weekend hours as well. So the only thing that really, Deanne has a fair amount of hours out of the county. She's paid 50% out of that. And she's paid a percentage out of county immunization because she coordinates that whole program. So those pots of county money will continue to be used for Deanne. And then my salary has to come out of county. It can't come out of the,
So is that
Grant
something
funding.
next year for the budget that some of this grant will be put into?
correct. So when we talked about the upcoming 2021 budget, and Scott can chime in if he wants to, because I know that he has seen what we have done so far, but a lot of the county funding, even in the upcoming budget that we may have asked for, may need to be changed a little bit now because we would use less county because now we, last week, were told about this additional EPI funding that will help pay for tracers in the upcoming 2 years. So that just means that less county funding would need to be used. And when I did a quick estimate, when I called Paul the other day, I think it was about $65,000 less out of county levy for 2021.
Just to echo what Cindy has said, when we talk about public health budgeting, what we've seen as a matter of course is Cindy will submit her budget, and then not more than 3 days later, the funding will change from the state, and then 3 days after that, that same funding will change again. So when we talk about funding for public health, very often Cindy gives her best estimate as to what's going on, and we make changes as it comes. Perfect example is, again, with COVID and everything happening there. What happens is there are times that state grant funds become available, and when that happens, Cindy and her staff do an excellent job of trying to maximize those funds, which therefore reduce the amount of county tax levy that we need to therefore spend. If that money has been budgeted and it is not spent, that then is returned to the general fund. Again, in the past, Cindy's done an excellent job of capturing as much of those grant dollars as possible. I assume that that's going to be the same thing here. In some ways, because of COVID, we're kind of playing it as it comes. So with the budget that we put in with 2020, it was with the best projection that we had, and then shortly after, here's some additional money that has now become available. So when that does happen, we then, if there's more grant funds that are available, we would then bring those extra revenues to the Finance Committee and to the board to approve as part of their budget, and then we would just go from there.
I'm going to ask this question, Scott. So this was a topic earlier.
Sure.
So our plan was, I guess, to discuss the budget this month, this meeting,
Mm-hmm.
and that didn't happen. And Virginia informed me that there is this discussion about it tomorrow night before the county board meeting. So are we able to, and do we have enough time at our October meeting to look at the budget? And if we do want any changes at that point, able to change them so that it is presentable to the county board in November? Or
Yep.
do we have to have another meeting on top of that or before that?
You have plenty of time. And again, let me try to explain the process that has happened since I have arrived.
Yep.
What the process is, and for those, I've explained this to the Finance Committee and maybe to the Executive Committee, and I'm not sure that I have done that to every single individual committee. Around the end of June, start of July, the Finance Director, Paul Kunish, sends out instruction letters to all the department heads to try to make them aware that we're now starting the budget process. Then the end of July, those spreadsheets and those worksheets go out, which gives the department heads roughly 3 to 4 weeks to put together their budget to submit to the Finance Director and the County Administrator. From there, that is reviewed by the Finance Director and myself, and we take a look if we believe that there are some changes that need to be made to the request. We have those conversations with those department heads, and then at the first county board meeting in September, I present the administrator's budget. Now, how this may differ than from what some other counties may do is I do not specifically have conversations with the standing committees as to what I am going to place in the proposed administrator's budget. And there's a specific reason for that. It's not that I don't want input, but to a certain degree, not only is the county budget a planning document, but it's also to a certain degree a slightly political document. And so when I put forward my proposed budget, it is to be done without any type of political consideration. It is what I believe is in the best long-term interest of the county. Therefore, from the time that I submit it in mid-September to when it is approved in the second week of November, the county board and its committees can make any changes to that budget that I have presented. And we've seen numerous examples throughout the years, whether that was last year regarding the UW extension position, whether it was the budget before that having to do with broadband funding and the like. So that's the long-winded answer to say, yes, Madam Chair, the committee should have sufficient time to be able to review the budget, and if they want any type of changes, they can then bring those recommendations to the Finance Committee. It would then be put on the Finance Committee agenda, and the Finance Committee could decide to make any changes that they want to the proposed budget. And then finally, the county board also has the opportunity to make any changes that they see fit as well.
All right, I think that answered our question.
Yeah, just to clarify, Scott, so it is no longer the process that the budget goes to the committee first.
Correct.
Okay.
That may have been under Ed.
Correct.
That has not been the case under my tenure. Again, it's a different style. I'm not saying one is right or one is wrong. Either one can work, and different counties do it different ways.
I think if I could clarify, Scott, on what you meant by political, you had mentioned at, I think, our finance meeting about that exact description. And that just means, I guess maybe a bias would be a better term, that this committee might be biased on our particular department and getting funding that the administrator would be filtering prior to us actually getting that administrator's budget. So I guess that's probably a rough description of what you meant by political.
Yes, it was small p, not meaning Republican, Democrat, liberal, or conservative. What it means is that it is not uncommon at all, and I'm not saying it's wrong, but it's not uncommon at all for committees to therefore promote and defend department budgets. My job as a county administrator is to look at the entire county as a whole, not any one specific committee. And so therefore, when I make my recommendation, I like to make it without having to take those factors into account. And then if the board or the finance committee does want to take those factors into account, you're the elected officials, you're the ones that make that decision. I feel my role is to present what I believe is the best and most equitable, and again, equitable is always in quotes, but the most equitable and fair budget that I can present, and then the board can make any changes that they see fit.
All right, thank you. Any other questions? Okay, Cindy, that financial, we're good, or
Good.
Okay,
Yep.
we're good. So let's move to the travel request and approval.
We have none.
Overtime, we talked about.
Yeah, and we continue to average, I would say, maybe less than 6 hours a weekend on overtime right now.
So then we move to the next meeting date, which I have penciled in October 12th at 8:30. Does everyone have that? Cindy, is that still good?
Yep.
And then let's move to November 9th. Does that look good for everybody?
Yep.
8:30. Everyone good for November 9th?
It works.
It works?
It's
8:30?
put in the
Okay.
plan.
Then we'll go with that. Any other matters? Yes, Linda?
I don't, I don't remember where I was anymore, but I picked up one of your, I'll just say it, Health Connections, little newsletter, front and back, one
Yes.
page. The committee used to get those, and I enjoy that, so could you see to it we,
Absolutely. I'll make sure you have
those
one on your
again.
desk the next time you guys come in. Yep.
thank you.
Yep.
Okay. Then, do I have a motion to adjourn?
I'll move.
A second?
I'll second.
All in favor, say aye.
Aye.
Opposed? The meeting is adjourned at 9:31.